Hello everyone, my name is E.Adiban and we are going to talk about overcrowding and waiting time in emergency department. Generally, patients come to emergency department to receive treatment for their chronic or acute conditions. Their medical conditions bring them to emergency department and they are seeking medical advice. Therefore, any patient comes to emergency department should follow a flow of care which starts from triage area and ends up being discharged from the emergency department. When the patients come to emergency department, most of the hospitals have different steps to see the patients and to treat them and provide them with proper care. So patients' wait time in emergency department is one of the most important topics in healthcare to be reviewed and discussed. Also, patient waiting time in emergency department create overcrowding in emergency departments, which will be the result of lack of treatment or reduce the quality of care for the patients. Therefore, in this presentation, we are going to discuss what we can do and how we can measure waiting time and overcrowding and the contributing factors in emergency department. To understand emergency department overcrowding, we need to have a great concepts that is built based on our methodology and then come to a conclusion and present some results that can either present a new approach to patient flow in emergency department. The importance of this topic is that, as we know, every day we are going to face new challenge in healthcare, and most of the challenges in healthcare is going to be taken care by emergency department staff and services. As we know and published by the literature, most of the patients come to emergency department either because they cannot receive medical care outside of the hospital or the lack of medical care availability at different timeline of the day. Based on that, emergency department should be able to receive a load of patients and try to identify how the emergency department can give them the support they needed, such as providing nursing care, providing medical care, and make sure they are safely admitted to the hospital or discharged from the hospital. Therefore, to manage this patient flow and understand it better, we are going to have a process identification in emergency department, and the methodology of the collecting the data will be both quantitative and qualitative approach. In the quantitative approach, the process is to measure the timeline that each patient follows in emergency department at any stage that they are waiting for different decisions, such as waiting for being seen by a triage nurse, or going to be waiting for physician to see them, or sometimes the physicians need either diagnostic test or blood works to be done and then reviewed by physicians in emergency department to be able to make a decision. So if any patient comes to emergency department and we have a healthcare worker or someone who can trace the timeline, we can find out how frequently and how long each patient waits to receive each steps of the treatment. Then by gathering that time and doing the calculation, we can find out how long the patients stay in the emergency department for their care, and overcrowding phenomena happens because of waiting hours in the emergency department. The second part that is related to qualitative data, it is to do interviews with the nurses in the emergency department to find out how each process and how each patient's pathway in emergency department contributes to the level of quality of care that they receive in emergency department. When we gather this type of data, so our methodology will be a mixed methodology of qualitative and quantitative data analysis, and then we measure the data to see uh, how long the patients stay in the emergency department and if the staying in emergency department has any impact on their care and quality of treatment they receive in emergency department. As a result, we are going to understand, are we going to change the process that we are at present having for patients in emergency department, or we need to present a new methodology for the patients or new process for the patients in emergency department to make sure that that waiting time for each patient is going to be shorter and the quality care can be improved. By doing so, when we measure both qualitative and quantitative data, which is waiting hours and quality of care, we can develop a new process and test it in emergency department and compare it with the current situation that we have in emergency. And after that, we can come to a conclusion to either the process that we developed is going to be effective for reducing time, wait time in emergency department for the patients, or we are going to have the new study or research be done to identify the new process or the new approach to elimination of waiting time in emergency department and improving the quality of care in emergency department for the patient. Therefore, for the study that we are going to conduct, we need to measure the current situation, present the new process for emergency department patients flow, and be able to have interview with the nurses and follow patient's path to know the wait time and quality of care delivery in the emergency department and measure them and compare them with the new process development, and then we get the outcome and develop a reason to see if the new developed process is better than the previous process, the same, or it doesn't have any impact on the waiting time in emergency department. I hope I have had the opportunity to present you with the approach to the emergency department overcrowding and waiting time concept and how we can do research and follow up with the reducing waiting time and improving quality of care in emergency department. This will improve our reliability and validity of the care in emergency department and having better patient's care outcome. Thank you and have a good time.